Hi, it's Dr. Tucker, and today we're going to focus on a common question people have about prevention in chiropractic. Why go to a chiropractor when you have no pain? It's like saying if you don't have diabetes, should you go to the gym? If you don't have heart disease, should you eat healthy? There's proactive steps you can take that can have a great impact. Now, when it comes to nutrition, I think most people have acknowledged there's benefit to this. When it comes to chiropractic, I think a lot of people just aren't educated on the actual benefits. So what we've found in our patient base, been in practice for over 20 years now seeing patients, is that there's a couple things that happens with people under maintenance. One, the frequency of flare-ups is less, right? So somebody has a history of having occasional back issues, and let's say their back goes out 4 or 5 times a year, we find maybe that diminishes down to just once a year if they're under chiropractic care. And even then, the duration of pain seems to minimize quite a bit when they're under regular proactive maintenance care. So there was a multi-center study on the National Library of Medicine. It was a Nordic maintenance program care, and they looked at how maintenance care can impact patients. So what they found was receiving maintenance care had flat pain trajectories around each new treatment period and reported fewer days with pain compared to patients receiving the controlled interventions. The entire effect attributed to dysfunctional subgroups who reported fewer days with activity-limiting pain with each new episode, as well as longer total pain-free periods between episodes. Essentially what they found was if you're getting maintenance care versus treating on demand when you have a flare-up, you had a difference of about 9 to 10 weeks between your flare-ups. So when you looked at the control group, they were getting about 3-week pain-free periods, as opposed to the chiropractic maintenance group, which was about 16 weeks pain-free. So there's definitely some tangible difference in people that go through chiropractic care with maintenance. So you don't just have to see a chiropractor when you're in pain, because one, you want to just be proactive, get a good diagnosis, just know with periodic checkups how your spine's doing. But two, you also want to make sure you're doing something to minimize your chance of having these flare-ups.